Hello, I'm Dr. Barrett. This video is for my patients only. If you've had a procedure by another physician, kind of hurts my feelings, but you should follow up with that physician and make sure you get your questions answered from that doctor specifically. If you're having a medical emergency, please make sure you dial 911 or go to the nearest emergency room. Congratulations, you've either just had a breast augmentation by me or about to get a breast augmentation and you're watching this video, which is good, because in this video we have everything that you need to know and look out for while you're recovering from your breast augmentation surgery. It's going to be a little bit of a roller coaster ride, but we're here for you, so stay tuned to the rest of this video and take notes. What to expect when you wake up? Well, in recovery, you'll feel a little bit of tightness in your chest. Rest assured, I inject a lot of numbing medicine in the chest area, so it's not going to be that bad. That little bit of tightness is from the implant partially underneath that muscle that stretches it out. It will get better with time. Magnesium helps with that, in addition to CBD and CBD Balm. You might wake up in a surgical bra or not, okay? Majority of my patients, I don't put you in a surgical bra because it's not needed and it can actually cut off the lymphatic drainage. For those of you who may be in a surgical bra, it's for a reason, probably to support the bottom portion of the breast to make sure that that stays firm while the rest of the breast kind of develops some shape, or if you've had a pocket repair on the inside. If you do have a bra on, keep it on until I see you in the office or when you need to take a shower. In terms of pain for breast augmentation surgery, I recommend to take Magnesium, 2 of the CALMg right when you get home and right before you go to bed. You can also take the CBD Balm and put it right here on the inside of the chest area and put a full dropper of CBD underneath your tongue. If that doesn't do the trick, you can take Tylenol, and if all else fails, then you can take the narcotics. I don't recommend to take those because they cause constipation and nausea, vomiting, okay? Even if you take a half of one, sometimes it causes people to get very nauseous. Do not take it to help you sleep. It does not give you good sleep. Only take it if you have a lot of pain and nothing else is working. The Zofran that you have in there, that is for nausea. You take one of those and you put it underneath your tongue. That helps with nausea pretty quickly. Otherwise, don't take it. Colace, take 1 pill twice a day until you have a bowel movement. That helps prevent constipation. You have antibiotics. Make sure you do take those antibiotics as soon as you get home. You take 1 every 6 hours if it's Keflex. You take 1 every 3 hours if it's clindamycin. Make sure you finish all the antibiotics and don't stop. It is normal to have a little bit of bleeding on your incision for the first 24 hours. It will eventually stop. You can always put a little bit of gauze and some pressure there temporarily to slow it down. Be sure you have your implant card. Take a picture of it with your phone right now so you'll always know what size implants you have. That card has a lot of important information for warranty information, okay? So you can check it out. If you have Mentor, you can actually register for an additional warranty, and Sientra has some other enhanced things that you can check out on the website as well. A few days out, your breasts may be swollen. They may look asymmetrical. One may drop more than the other. That's completely normal. It takes 6 weeks for them to start to drop and settle, so don't expect them to look normal right away or achieve your final result right away. It is normal to have swelling and bruising after surgery. Sometimes one swells more than the other, but again, if one side swells way more than the other, we need to know about it because that could be a hematoma. We have a plan for your sutures. If you're in office, typically we remove the nylon sutures at week 1 and then the Prolene sutures at week 2. If you're out of town, we don't necessarily always use that Prolene suture line, but after those sutures come out, sometimes you have a little bit of absorbable sutures that poke through. If that happens, you can take a little beauty scissors and trim that, or you can come to see us in the office and we'll take care of it. That's called a spitting suture. It's not a big deal, happens all the time. The sutures that are absorbable sometimes make their way to the surface. Sometimes you can get a blister on the edge of the dressing. If that happens, leave it alone. We'll take care of it when you come to the office. Don't try to unroof it. Put antibiotic ointment on it if it does get unroofed until we can take a look at it. Not a big deal though. We recommend using red light every day after your surgery in the general area of your procedure to help with pain, swelling, and healing. It also helps with scar appearance. We do have a professional red light panel in our office, so please make sure you ask about that. Multiple treatments can be provided while you're healing. You can take a shower 24 hours after your procedure time. All right, it's not necessary that you do, but if you feel like taking a shower, you can. You can let the water run over everything. Don't take a hot tub, bathtub, jacuzzi, swimming stuff until 6 weeks. That way water doesn't get into the incision. Again, water running over is okay, but sitting in still water is not okay. I recommend you sleep elevated slightly, about 30 degrees for the first 3 days, then start to lay flat, and about a week start to lay on your side, and that's okay. Generally, we don't want to lay on our stomach until 6 weeks. If you have some numbness in your nipples after the surgery, don't panic. That happens many times. It doesn't necessarily mean there's permanent nerve damage, but a lot of times things get kind of rattled from the surgery and they temporarily shut down. They sometimes will wake up. Oftentimes, almost every time, they will wake up and you'll gain back the sensitivity to the nipples. Sometimes it becomes hypersensitive. In fact, the majority of the time you get hypersensitivity for about 6 months and then it starts to come down, okay? Now, if you want to improve the sensitivity of the nipples, you can actually do some kind of vibration therapy. If you have something that vibrates, you put it on it twice a day. That will help regrow the nerves, in addition to taking alpha-lipoic acid as a supplement to help regrow those nerves as well. What's your activity regimen after breast augmentation surgery? Well, I want you walking around right away. Don't be in bed all day. Bed is just for sleep, and then you move around the house like you normally would. I don't want you to do, heavy lifting for 6 weeks, but I do want you walking for the first week to 2 weeks. Make sure you're walking around at least 3 times a day. After the first week, you could do some slight isolated leg exercises like calf raises or leg extensions, but not getting your heart rate up. You can get your heart rate up at week 2. Things like walking incline on a treadmill delicately or stair workouts is okay. Light jogging is okay at 4 weeks, and then upper body is okay at 6 weeks, but you have to use your body as a guide. If something hurts, you back off, right? Don't get back into the same weight that you started prior to the operation, maybe about 20 to 25% of the weight that you were doing prior to the surgery, and then each week kind of add up to that what you were doing prior. I don't recommend implant massage until about 6 weeks. I have a specific video on that. Generally, I like to tell you exactly how to massage at the 6-week mark, but basically you want to massage generally from the side over towards the other shoulder. We do have a specific video on that if you're interested. So here's my secret for pain after your surgery, okay? CBD balm, take a little bit of this, massage it right into the muscle. It's gonna relieve that pain within 15 minutes, all right? There's also CBD tincture. You can take this at night, it helps you sleep, but it also helps the pain. Take up to 4 full droppers of those underneath your tongue every day, if you need to. Lastly is the CALMg. Take 2 of these when you get home from surgery and 2 right before you go to bed. It has 7 different types of magnesiums in it, which helps relax the muscles and helps you calm down and helps reduce pain. Here is the ultimate supplement that you will need after your surgery to help you heal. I used to use different types of multivitamins to provide for my patients, and then I figured out that there's some things that I couldn't find in commercially available products, so I went ahead and designed my own, okay? So there's before and then there's after. Before, you want to take 15 days prior to your surgery. A lot of times after surgery, your stomach can't really absorb things very well, so you want to start ahead of time. You can take these on an empty stomach or with food, it doesn't really matter. You want to start the day of your procedure, so don't wait till the next day, start right away, before and after. Makes sense. And then our Arnica Plus, which helps decrease the swelling and bruising. You take 2 of those starting the day after your surgery every single day. I recommend fish oil after surgery. You generally want to wait 7 days from the time of your surgery. The reason why is there's a study that shows that it decreases your rate of capsule contracture after surgery. It's also pretty healthy for you. So the fish oil I recommend is Living Fuel Super Essentials Omegas, okay? This has a really good concentration 1-to-1 of EPA to DHA. A lot of the fish oil that's out there, especially if it's cheap, is crap. I don't recommend it. This is the one that I found has the best amount of inflammatory improvement and helps decrease the risk of capsule contracture. After your surgery, I want you to use these Scar Shield strips, okay? You can put it right in the incision, and you want to do that for a total of 6 months. You can also use Scar Gel in addition to that by massaging it deeply into the incision. So to help you recover after your surgery, I put together the essentials of all the supplies that you would need and then some. This makes a great first aid kit, even if you don't use everything that's in here, but chances are you might need something that's in here. And I put it all together for you. Everything from earplugs, ice packs, to gloves, gauze, stuff that you would need after a surgery, stuff that I would want, high quality stuff that we can get at a wholesale price. And we're able to put this in here for you so that you don't have to run to the store to get all these individual things to help you recover after your surgery. Barrett Recovery Kit. If you have the following, please give us a call. If you have dramatic pain on one side of the chest versus the other, or pain that's just not controlled in general. If you have swelling that's dramatic, a little bit of swelling is normal, but especially if it's one side versus the other. If you have redness that spreads out from your incision or any foul smelling odor from your incision. If you get a fever that's greater than 100.3, if you get nausea, vomiting, and you're not able to eat or drink anything, or you get dizzy, lightheaded, and you pass out. Here are some examples of things you shouldn't do after surgery that I've had patients come back with a hematoma. I've had a person open a door that pulled like this and caused herself a hematoma. I've had another patient lift a gas pump. This is all within the first 6 weeks. Lift gas to pump gas, and that happened. Lifting an overhead bag into the overhead compartment caused a hematoma on one patient one particular time. I had one patient open an Amazon box and caused bleeding on one side. Those are some examples of some common things you might not think of that could be problematic for your healing. So really take it easy. Have other people cater to you during this time period. If you have a little one, make sure you get a TushBaby so that you can hold the little one on your hip without having to use your arms. So in summary, stay positive. It's normal to get the booby blues after surgery, so if you feel a little emotional, it is quite normal, especially after undergoing surgery. Your surgery is going to work out great. Breasts take time to settle and heal. Breasts are sisters, they're not twins. They're never going to look perfectly identical, and sometimes one drops faster than the other. It is something that we could take a look at your post-operative visit. It's normal to feel the implant a little bit if you feel for it. What we don't want to see is rippling on the outside, but sometimes that does happen. Final results typically are around 6 months. Again, congratulations on reaching this point. If you have any additional questions, please don't hesitate to reach out to the office, give us a call, or shoot us an email, and we'll get back to you. Thanks again, and good luck on your journey.